Today we'll be speaking about the role of MRI in evaluation of vital pathologies. My name is Dr. Anubhav Chandna and I'm a third year junior resident in JNMC Belgaum. The co-authors for my presentation will be Dr. Rajendra B. Mali and Dr. Santosh Patil. We'll be discussing about the aims and objectives of the paper. We'll be discussing about the materials, methods, the cases themselves, the results and discussion. The aim will be to establish the role of MRI in evaluation amongst patients presenting with orbital lesions or optic complaints. The study investigated 22 patients who had undergone MRI brain and orbit scans from the Department of Radiodiagnosis at Dr. Prabhakar Kore Hospital in Belgaum. The duration of the study was 2 years, and the anatomical and pathological changes were identified via T1, T2 flare diffusion and T1 fat site contrast enhancing images, which were acquired by Siemens 3 Tesla MRI. The patients with suspected orbital lesions and visual complaints were included in the study, and the patients who had contraindications to MRI and were not willing for examination were excluded from the study. This was a case of a 73-year-old female who came with complaints of bilateral orbital swelling, proptosis, and ocular congestion. As we can see here, there are presence of extracorneal soft tissue masses that were seen superior to the superior rectus that were causing mass effect on it. These soft tissue lesions show restricted diffusion. On contrast enhancement, these lesions showed avid contrast enhancement, and there was perineural spread of the lesion along the V3 segment on both sides to the foramen ovale. Additionally, there were abnormal enhancing soft tissue masses in the parapharyngeal spaces. Along with that, there was also presence of hypophysitis with thickening of the infundibular stalk here, along with the packing meningitis alongside the clivus. Orbital biopsy was performed for this patient, which revealed IgG4-related lymphoproliferative disorders. IgG4 cells were more than 40% of the 40%. For the CECT was done for this patient, which revealed ill-defined renal cortical lesions. Alongside the ill-defined renal cortical lesions, there was also presence of periaortitis here. Pelvic wall thickening was also present. There was bronchial wall thickening along with central lobular nodules. Pharyngitis was present, as well as mucosal thickening involving the paranasal sinuses. There was also presence of submandibular gland involvement with the small focus of mediastinitis, along with mediastinal lymph nodes here. Now, IgG4-related disease can present in multiple ways. One such as being Ormond's disease, autoimmune pancreatitis, which is the most common method of its presentation, IgG4-related lung disease, sclerosing mesenteritis, sclerosing cholangitis, and the other ways that we've seen here, such as the orbital, mediastinal disease, the head and neck disease, the renal disease. This was a case of a 17-year-old female who presented with diffuse headache and visual loss on the left side. We can see there was a fairly well-defined homogeneously enhancing lesion that was arising from the optic nerve, the intracanalicular portion here, which was extending into the paracellular region and causing mass effect on the brain parenchyma. The lesion showed facilitated diffusion here and was seen to homogeneously enhance on the contrast images. Now, final diagnosis for this was optochiasmatic glioma. Now, optic pathway gliomas are most common primary neoplasms of the optic nerve. The majority in pediatric population are present as low-grade astrocytomas. Bilateral optic nerve gliomas, we should be thinking in terms of NF1. The adults may present with more aggressive forms, such as high-grade astrocytomas. These typically are T2 hyperintense and present with nerve enlargement related to the contralateral nerve. Contrast enhancement is frequently minimal or absent in low-grade gliomas, however, it can be present in high-grade gliomas. A close differential for these will be an optic meningioma. And in patients with sporadic gliomas, these tend to manifest with mass-like nerve enlargement, possibly with cystic components. Coming on to case 3, which is a case of 63-year-old male presenting with progressive impairment of vision for 7 months. This showed a ovoid-shaped lesion that was present in the posterior segment of the eye here, which was T2 hypointense, T1 hyperintense, and showed enhancement on the T1 fat side contrast imaging. The final diagnosis for this was choroidal melanoma. Now, these are the most common tumors of the adult eye. However, these are uncommon in the Indian population. These present as ovoid-shaped lesions in the posterior segment and may be associated with retinal detachment. T1 hyperintense, these are T2 low signal intensity and show contrast enhancement. Now, this was a case of a 52-year-old female who was a known case of hypothyroidism presenting with bilateral exophthalmos and diplopia. We can see the abnormal T2 hyperintensities that are present in the medial rectus and the inferior rectus here, which are bilaterally symmetrical, and the extraocular muscles appear enlarged here. So this was a case of thyroid associated orbitopathy. Now, this is an autoimmune disorder of the orbital tissue associated with this thyroidism. Typically is bilateral and symmetrical. Now, there is fusiform thickening of the muscle belly with sparing of the tendinous insertions, also known as a Coca-Cola sign. There is increased orbital fat volume. And in acute and chronic stages, the extraocular muscles will be bulky, firstly due to edema, then later on by fibrosis and fatty infiltration. And the mnemonic to remember it by is I am slow. Now, case 5. Now, this was a case of 73-year-old male presenting with painless ophthalmoplegia and exophthalmos. There was a T2 hyperintense mass in the lateral extracorneal compartment of the left orbit, which was seen causing mass on the medial rectus and resulting in proptosis of the eye. The lesion, as we can see, was showing restricted diffusion, and there was homogeneous enhancement of the lesion here. So this was a lymphoma. Now, these typically present in 50 to 70-year-old patients with orbital swelling, proptosis, and diplopia. These are highly cellular tumors, thus show restricted diffusion on DWI sequences, and these show homogeneous mild to moderate enhancement. Now, this was a case 6. This was a 73-year-old male patient presenting with left-sided orbital pain, diplopia, and restriction of elevation. Now, there was T2 heterointense lesion in the superolateral aspect of the extracorneal space, which was seen arising from the lacrimal gland here, infiltrating into the superior and the lateral rectus, and showed restricted diffusion here. Now, this turned out to be adenoid cystic carcinoma. This was an extracorneal malignant neoplasm of the orbital lobe of the lacrimal gland. Now, this lesion presents with orbital pain. This is highly aggressive and has a poor prognosis. Characteristically, it is a moderately enhancing infiltrative mass associated with bony destruction. The other differentials to be considered are GPA, which is granulomatosis with polyangiitis, Sjogren's syndromes, and the other lymphoproliferative disorders need to be considered. Now, this was a case of myeloid sarcoma, which is scleroma. Initially, this patient presented to us with bilateral asymmetrical proptosis. The lesions were T2 heterointense, showed restricted diffusion as that can be depicted here, showed fairly homogeneous enhancement. Alongside it, there was a enhancing soft tissue involving the body of the mandible and inferior alveolar arch with thickening of the mandibular nerve here, which is possible due to the perineural spread of the lesion. Now, this turned out to be orbital leukemia. Ocular leukemia is uncommon and typically it occurs in form of myeloid sarcoma in patients with acute myeloid leukemia. The ocular disease is the first manifestation of the myeloproliferative disorders. This is T1 and T2 isointense to slightly hypointense and shows the restricted diffusivity and homogeneous enhancement. The other differential to be considered in this will be rhabdomyosarcoma. Although orbital lymphoma and leukemias are presented here in the extracorneal groups, these can also manifest as osseous or rarely as intraocular lesions. Now, this was a case, a 35-year-old female presenting with diplopia and blurring of vision since 6 months. Now, this was a case of cavernous venous malformation. T1, it was hypointense. T2, it was fairly heterointense and showed avid contrast enhancement. Now, these are most common benign orbital masses in adults. These are slow-growing encapsulated masses containing the dilated venous blood vessels, typically present in the lateral retrobulbar intracorneal space. However, it can also be present in orbital apex and intra-extracorneal space, which are rarely encountered. Larger lesions cause functional symptoms, whereas the smaller lesions, particularly at the orbital apex, can cause visual loss due to optic nerve compression. Now, CVMs show mild arterial enhancement with progressive fill-in and subsequent homogeneous or heterogeneous enhancement on the delayed phases. As for the results, the age distribution was more so towards the adult population. 20 cases were more than 18 years old, and 2 cases were less than 18 years old. There were 9 male patients and there were 13 female patients. This was the case distribution for which 4 cases were of optic neuritis, 3 cases of cellulitis. TAO was 2 cases, similarly for lymphoma, glioma, and posterior staphylomas. 1 case of IgG4 related disease, 1 case of orbital leukemia, 1 case of choroidal melanoma, 1 case of adenoid cystic carcinoma, retinal detachment, dacroadenitis, and CVM each. MRI effectively detects the abnormalities such as the thyroid-associated orbitopathy, neoplasms, vascular malformations, and lymphoproliferative disorders. It is also helpful in guiding management of patients with suspected orbital masses and visual complaints by soft tissue characterization, their extent in determining the pathology. In cases with insufficient history and clinical examination, MRI plays a crucial role in guiding further management. Now, limitations for the study was that it was a single center study, so it may not represent a wider population. Cross-sectional nature of the study limits the capacity to demonstrate temporal association and cause and effect relationship between the imaging findings and the clinical outcomes here. So these were my references. Thank you.